Dear all, welcome to this session of the EASM project. Today we will talk about the module 3, which deal with the evaluation of verbal and non-verbal communication skills. First of all, let me show you this is the program of today's session. We will have a very short recap of the previous session, and then we will go in more details on the verbal and non-verbal communication skills with some examples and some practical tips. And then we will talk about communication strategies and how to improve our communication strategies by using role plays. And then we will have the final part for discussion and then closing remarks. And first of all, let me summarize what we have discussed in the previous session. We described some practical tips on how to increase our therapeutic relationship. First of all, we discussed about the opportunity of the fact that it is very important to introduce ourselves to our patients. Sometimes it is a good thing to call the patient with his or her name, and then we should always take care of the fact that privacy should be promoted, and we should reassure patients that always we aim to improve their privacy, and then we should use our strategies for active listening, because as we have already seen, using this active listening, like rephrasing the things that are stated by the patients, represent a very effective way to demonstrate to the patient that we are really trying to understand his or her feelings. And then we should always try to keep in contact, but also keeping in mind that sometimes people can feel scared or intimidated by this kind of contact. So we should modify and adapt it according to the necessity and to the feature of the person that we are interacting. And then, first of all, maintaining professional boundaries. And we know that all these aspects are very important and should always taken into consideration in order to improve our therapeutic relationship. In particular, in the previous session, we have also discussed some specific skills that we should use in order to improve our active listening skills. For example, here, as I already told you, the technique or paraphrasing or restating. Then the technique of asking in order to get more information about the aspect concerned to the patients, and then asking why he or she did in a specific way. And then also, for example, clarifying, trying to explain better in your words what you think you have understood from the patient's point of view, and so on and so forth. So I would really encourage you to use all these strategies because they are very useful and very important in order to improve our relationship with our patient. And then we also have discussed about some practical tips on how to engage patients with severe mental disorder in a sport-based rehabilitation intervention. First of all, we discussed on the fact that it is very important, first of all, to evaluate patients' expectation toward sport-based intervention, because if the patient is not very motivated in starting to do this activity, it is very unlikely that he or she will be able to start and to continue this sport-based intervention. And a practical way to evaluate the personal attitudes toward sport should be formulating some very simple questions, like the ones that you can see here in this green box. For example, have you ever practiced any sport activity during your life? Because of course you can imagine that if you have in front of you a person that has never done sport before, of course it will be very challenging for you try to motivate him or her to start doing a specific activity that he or she has never had the opportunity to perform in his or her entire life. And then at the end you should describe the potentiality and the utility of performing this sport-based sport-based intervention. We also have discussed about the main feature that a sport-based intervention program should have. For example, trying to provide the people with clear and strict information, rules, skills, and techniques, try to develop it in a very game-based format, and try to moderate competition, because sometimes you know that competition should be also a sort of source for frustration. So, of course, for people that have never tried to do sport before, we should keep a specific eye on this aspect. And this was for trying to get to know each other better, but I guess that now we obtained enough information, and now we can start with today's session with the topic that I have just introduced. So here you can see this is a video in which you can see that some examples about communication skills. But why we need to talk about communication? We need to talk about communication, and in particular about verbal and non-verbal communication, because this represents a very sensitive issue in order to develop a good relationship between healthcare professionals and patients. Because of course, based on the style of communication, of the type of communication, of the quality of our communication, it depends the adherence for the patients to our program, his or her satisfaction with care, and also at the end the outcomes that we aim to achieve at the end of this intervention. Also, it is particularly important to focus our attention to the non-verbal dimension of communication. Why? Because in our daily life, we already know that part of our communication skills are mediated by the non-verbal dimension. That is called sometimes, as I have written here, a sort of silent language that include cues, gestures, vocal styles, and many other aspects that are very sensitive in order to engage people in our communication. Because of course, communicating, it is not just pronouncing some words, but is a very complex and dynamic phenomenon. And so this is particularly important when we try to communicate with people that have also some mental disorders or some mental health problems. And here you can see some examples of what is verbal communication and what are the features of non-verbal communications. In particular, verbal communication include, of course, the volume of the voice, the quality of the voice, the intonation, the voice speed, and so on and so forth. While the non-verbal communication includes some other aspects that, for example, now that I am talking with you using a video, because I am based in Italy and you are based in your own countries, of course, maybe you are missing some of my facial expressions, we are missing a contact, and also you are not able to see all my body and so all my body movements. And also in particular, please remember this dimension of use of space, personal and social space, which represents another very sensitive issue that we should consider in our way of communicating in our clinical activity. And why it is so important, and we decided to have a specific focus on these two dimensions of verbal and non-verbal communications, because of course the non-verbal communication can take even more time for vehiculate some words compared to the verbal one. And so it is also a way for engaging better people in the communication and also in the relationship. But the problem is also that sometimes people with mental disorders can have some problems, some difficulties in catch some aspects of non-verbal communication. And this is you will be able to find at this link a video for a demonstration of non-verbal communication styles. And with this slide, instead, I would like to catch your attention on some aspect of non-verbal communication that we should try to avoid when we are meeting for the first time patients with mental disorder. Of course, it would be good to have a good smile, a good posture, having hands naturally hanging at the side, while it is not really very welcoming being like this young man here with looking down, a slump, fit together, because of course it is not really inviting or welcoming me in doing something. And of course, in the nonverbal communication and body language, we evaluate all these aspects. First of all, of what we are wearing, how we are looking, but also, of course, the posture is another element that we evaluate. Again, the eye contact and smile represent really very important issues, as well as the facial expression and the gesture. And as you can see here, I have already introduced you the concept of the personal space. And if you click on this link, you will see some practical examples of what we mean with personal space. And now this concept is a sort of a very personal concept, and it depends on many sociocultural dimensions and factors, and it can be so many very varying between one person to another person. And traditionally, we can describe the space as an intimate space, the personal space, the social space, and the public space. And why it is important to know that all these dimensions exist? Because, of course, according to the activity, to the social situation, or to the type of relationship that we have with the other person, of course, this distance can be modified. But of course, in particular with sport activities, we know that this is a completely different situation in which this dimension is always different. And why this is important? Because this scientist Edward Hall described for the first time the concept of subject dimension, in which each of us is immersed, and he tried to define this hidden dimension and to explain why it is different between one person to another. And the personal space, so, is the region which surrounds a person regarding his psychological dimension. And so most people value their personal space and feel discomfort, anger, anxiety when personal space is altered or is reduced. And so permitting to a person to enter personal space is really a very important aspect to consider when we are trying to evaluate the type of relationship that we have with the person. And so this is, I'm moving to my conclusion. These are some practical skills on how to improve nonverbal communication, like maintaining eye contact, nod our hand, smiling, and also use a tone of voice that is concordant with the main message of what I am saying. And you should always take into account all these very easy and straightforward suggestions, because really this suggestion can make the difference in your relationship with the patient. This is a role play. I invite you to try to perform it with your colleagues at your own, and to see and to evaluate what happened with your nonverbal communication skills. And then on this video, you can see some examples of what is good communication and bad communication. And these were my last slides. So if you have any questions, please do not hesitate to write me an email, or to ask me, or also to send me messages in order to obtain some more detailed information. Thank you, and see you on the next session. Bye.